COVID-19 Hello everybody, today I'm going to talk about COVID-19. Do you guys know what is COVID-19? COVID-19 is a disease caused by a new strain of coronavirus. CO stands for corona, and VI for virus, and D for disease. Formerly, the disease known as the 2019 novel coronavirus or 2019 nCoV. The COVID-19 virus is a new virus linked to the same family as the severe acute respiratory syndrome, SARS, and some types of common cold. Do you guys know how COVID-19 spreads? This virus can be transmitted through direct contact with the respiratory droplets of an infected person, generated through coughing and sneezing. Individuals can also be infected from touching surfaces contaminated with the virus and touching their face, example, their eyes, their nose, and their mouths. The COVID-19 virus may survive on surfaces for several hours, but simple disinfections can kill it. Do you guys know the symptoms of COVID-19? Symptoms include fever, cough, and shortness of breath. In more severe cases, it can cause pneumonia and difficulty in breathing. In more rarely, the disease can be fatal. These symptoms are similar to the flu, influenza, or the common cold, which are way more common than COVID-19. This is why testing is required to see if a person has COVID-19 or not. Do you guys know who is more at risk? We are learning about COVID-19 effect and how it affects people every day. Older people and people with chronic medical conditions such as diabetes and heart disease appear to be more prone to developing the severe symptoms. As this is a new virus, we are still learning about how it affects children. We know it is able to affect all people of all ages, but it rarely infects children. So far, mainly the COVID-19 cases are so far mainly among older people and people with pre-existing medical conditions. What is the treatment for COVID-19, you may ask? There are currently a few available vaccines for COVID-19. Many of the symptoms can be treated, and getting early health care from a healthcare provider can make the disease less dangerous. There are several clinical trials to evaluate potential therapeutics for COVID-19. You may ask, how can the spread of COVID-19 be slowed? As with other respiratory infections like the flu or common cold, public health measures are critical to slow the spread of the illness. Public health measures are everyday preventive actions that include staying home when sick, covering mouth and nose with flexed elbow or with a tissue when sneezing or coughing, dispose of used tissues immediately, washing hands often with warm water and soap, and cleaning frequently touched surfaces and objects. As we learn more about COVID, public health officials may recommend additional actions. Thank you for watching. Please like and subscribe so I can do more research and give you guys more knowledge.